um, health informatics have a very strong relationship with the human being and the internet. Like some public data, some data from the Twitter, Facebook can predict some disease. So Professor Yang did a research that find a relationship between the opioids search times and the heroin emergency room visit times. So in his team, he selected 10 cities: Boston, Chicago, Denver, Detroit, Minneapolis, New York City, Phoenix, San Francisco, Seattle, and Miami. But the Miami data is cancelled because it do not have the sufficient data to use and analyze. So and then he checked the 12 opioids related data, medical data, using the marginal R2 value to check the correlationship and check the qualify of the fitting rate between the opioids medicine and those um, heroin heroin emergency room visited times. So with a lot of the data analyzed, he got the conclusion that Minneapolis, Minneapolis had the largest annual increasing for the heroin emergency room visited, which is increased 22.7%, and San Francisco decreased a lot, which decreased 20.6 and in 2011 in the United States, the heroin related emergency room visited time increased around 11%. So for the core relationships, there are three medical have made a perfect score. One is the Vanza, another is Methadone, and the third one is China White. So in order to make less people go into the heroin emergency visit, or the forecast how many people will visit emergency room because of the heroin, we can use those data to check it. And moreover, I have an idea if this tracking way can use for the another disease like cold or fevers. So like if someone searching like get high fevers, is it possible to relate it to the cold rate? Thank you.
Hi, so today I'm going to talk about the public health point of view kind of perspective on using internet searching data. So internet searching data such as those available by Google Trends have been used as a low-cost real-time data source for monitoring and predicting a variety of public health outcomes. So, for example, a typical human behavior is to run to Google when we feel pain in our side or like we see a weird rash in our body because we are often embarrassed to seek medical attention. So, by looking at commonly searched up medical illnesses and symptoms, public health officials can see what specific problems we need to focus on more. So, for example, like if we see like a certain population in a certain geographical location is searching up basically like HIV or chlamydia or gonorrhea, we'll know that we need to remove or at least help start that advocacy of removing the stigma around like STDs, for example. And internet searching data can also give public health an outlook of epidemiological trends around certain locations. And it can also help us see cultural trends around those locations so they can prepare prevention and treatment plans that accommodate people from all backgrounds, especially like the minority populations who are afraid to seek help due to their cultural like traditions. And so an opinion that I wanted to put into this is I read an article that's basically from the participant generated reasons for avoiding like medical care. The article is titled "Why People Avoid Medical Care," and the top like reasonings were like believe illnesses will improve on time or its own, so like they don't realize the severity, or doctor would not take it seriously. They prefer natural remedies because of like cultural traditions or beliefs, or even things as little as like medical inaccessibility, like we're not making it available for the underserved and low income populations, and also like fear of results of what their test results could be, and fear of the stigma, of course.
Hi, let's talk about the ethics of predictive analysis usage. In my opinion, while using data gathered from people's search histories and social media posts can be a good resource for more current predictions, there are landmines to be careful of before going in full dive. First of all, computers are dumb. They can only enact what people program into them. So while you're designing an algorithm to gather information related to drug or sex-related keywords, there's a context behind the search or post that a computer cannot calculate or anticipate. We're humans. We have a bunch of emotions, and computers can't necessarily get into that. So having data that is aggregated is a fast and effective process. Such data needs to be taken with a grain of salt. One solution to rectify this problem is programming an AI and teaching it how to process such things, but with how weird our language is, and just essentially with the nature of how humans are. I'm not sure how successful such implementations would be currently. Another problem is not letting the algorithm conflict with quality of care for patients is another issue. There's only so much weight big data can have, but ultimately the doctor needs to prioritize what the patient needs because there's so many stakeholders involved, and you don't know if they're prioritizing cheapness over quality of care and whatnot.
While discussing these articles, I must agree with my teammate Noreen about the use of predictive analysis and ethics. In the article Role Predictive Analysis, it mentions the potential biases and misuses the predictive analysis algorithm may have among physicians, but ensures that, and I quote from the article, physicians who have ethical and professional obligations to represent patients' best interests will be on the front lines for ensuring that this emerging technology does not interfere with high-quality, individualized, patient-centered care, end quote. My first question after reading this was how? How does one choose who is the most ethical? Who's the one choosing these people, and what are the standards of being an ethical person? Much like the development of the algorithm, the input of all parties such as physicians, patients, etc. should come up with a consensus of what is the basis or standard of ethical practice. My second question was, is it only taking data from medical records or through outside sources as well? In another article by Sean D. Young and others, it talks about being able to predict the number of visits to an emergency department due to opioid-related care by searching through Google searches. With the help of keywords and terms, they were able to see the rise of an opioid crisis in a variety of cities, which then brought attention to the severity of treatment for opioid patients. This could be a very useful data while developing a predictive analysis system, and I think only focusing on electronic medical records isn't the best way to go for providing the best care of all patients.